Hello and welcome everyone to this special ACR preview podcast brought to you by the Immune-Mediated Inflammatory Disease Forum. My name is Professor Peter Nash from the School of Medicine, Griffith University, and I direct the Rheumatology Research Unit on the Sunshine Coast in Australia. I'm joined today by Janet Pope, who is a Professor of Medicine in the Division of Rheumatology at the University of Western Ontario, Sulich School of Medicine, and Atul Deodhar, who's the Professor of Medicine and Medical Director of the Rheumatology Clinics in the Division of Arthritis and Rheumatic Diseases at the Oregon Health and Science University in Portland. In this podcast, we'd like to introduce and discuss some of the key abstracts and presentations we've highlighted on our brochures that we're looking forward to examining in detail at this year's ACR in Chicago. The annual ACR Congress is an important gathering of people and ideas in the world of rheumatology, with an extensive scientific program covering a wide range of diseases and treatment options delivered through symposia, poster sessions, presentations. Rheumatologists get to engage with the latest data for therapies that impact clinical practice. The IMID Forum is here to help direct you towards the most valuable content that will help you stay up to date with clinical practice. As with previous years, we'll bring you daily highlight podcasts and an overall Congress review to help you get the most out of this year's ACR. This year, we've identified many abstracts covering key IMID topics. Our highlights can be found in our review brochure. You can pick up these highlight brochures at a stand at 2105 at ACR, or find them on the IMID Forum website, which includes all the session times for the key abstracts we've selected this year. If you'd also like to keep up to date with lupus and scleroderma at ACR 2025, be sure to visit the lupusforum.com and the scleroderma-forum.com, where you'll find a preview brochure featuring the steering committee abstract selections for both of these important indications. So let's take a look at some of the IMID selections this year, and we'll start with rheumatoid arthritis. Rheumatoid will be the first area we'll be highlighting, and the abstracts this year focus on both emerging and existing therapies for the clinical management of rheumatoid arthritis. There'll be several sessions that discuss data on new treatment options at this year's ACR. Roy Fleischman in abstract 1676 looks at the 7-year outcomes of the Select Compare study evaluating long-term safety and efficacy of upadacitinib, the JAK1 preferred inhibitor, versus adalimumab in rheumatoid arthritis. Andrew Oster in abstract 1349 shares final 2-year results from the Uphold study, which focuses on real-world achievement of treatment targets and maintenance of response on upadacitinib. Complementing these practice-based snapshots from the clinical trial world, Dr. Gonzalez Mozo de Rosales in abstract 0485 presents a multi-center experience with upadacitinib in patients previously treated with another JAK inhibitor, baricitinib, while Omar Al-Tabar in abstract 0489 summarizes the contemporary efficacy and safety of JAKs in routine RA care. Mayakashko in abstract 1359 adds a comparative lens with a retrospective cohort analysis of tofacitinib safety in rheumatoid arthritis. Yuan Zhu in abstract 2288 contributes a post-hoc analysis from a phase 3 trial on invermacitinib, which is a JAK1 inhibitor already licensed for use in China in moderate to severe rheumatoid arthritis. Useful context as the field evaluates where and if to fit additional JAK pathway modulators in an increasingly crowded landscape. Safety, of course, remains a central theme as JAKs are used across multiple lines of therapy. Li Lu in abstract 0490 presents a systematic review and network meta-analysis quantifying infection risks with JAK inhibitor monotherapy versus combination regimens, helping clinicians calibrate risk when tailoring treatment intensity. If we look beyond the JAKs to emerging therapies, there are novel mechanisms continue to advance and be studied. J. Tuttle in abstract 0473 reports a phase 2b dose-ranging study of peresolimab in adults with rheumatoid arthritis, which explores the PD-1 pathway agonism as a new immunomodulatory approach. Frederick Albach in abstract 0471 shares preliminary results from an open label randomized controlled phase 1 study called the COMPARE study, offering an early look at KYV101, which is an anti-CD19 CAR T therapy in rheumatoid arthritis, and Corey Tasselar in abstract 2279 presents long-term prevention data in high-risk individuals from the ARIA trial of abatacept, informing how and when to act before synovitis becomes entrenched. Real-world datasets offer a pragmatic view on persistence and use patterns in patients who could never get into clinical trials for a variety of comorbidities and co-medications. And Jeffrey Curtis in abstract 0369 examines real-world persistence of JAK inhibitors among biologic-experienced RA patients, shedding light on durability outside the clinical trial setting. Joseph Nathan in abstract 0479 details real-world JAK experience across immune-mediated diseases, including the reasons for discontinuations. So there are many, many RA abstracts that will be highlighting and giving you full details. And now we'll hand over to Janet Pope, who'll look at the abstracts that she found exciting and interesting in the area of psoriatic arthritis. Over to you, Janet.
Thank you, Peter. Let's move on now to psoriatic arthritis. There's really a lot to look forward to this year at the ACR, and it was tough to choose the abstracts, lots of great ones. So I'm going to talk in different areas. I'm going to talk on TYK2, IL-17s, IL-23s, JAKs, and some real-world management. So lots of good things coming up. So as far as TYK2 inhibitors go, this year, actually, my colleague, who's also presenting, Professor Atul Deodhar, will be on abstract 0874, and he's going to discuss pivotal phase 3 studies with deucravacitinib, and they do show meaningful improvements in disease activity across joints and skin endpoints in active PsA. Abstract 2351 will be Professor Amit Chaudhry, and he'll be talking about ATTACK 279. So it's zasocitinib, and the program has modulated TYK2 pathways and has clinical response that's positive. In addition to these ones, Lee Eder from Toronto, Canada, number 2356, she's going to present a pooled analysis of pivotal deucravacitinib studies demonstrating basically comparable efficacy in men and women with PsA patients. So lots to look forward to in that area. What about moving on to the IL-17s? So we know IL-17 A to F as well as other IL-17 inhibitors. So what's going on there? There's a lot. So basically on IL-17 inhibition, there's multiple abstracts on long-term safety of the broader impact of IL-17 A and F blockade, just like there's long-term safety now on IL-A inhibition from before. Phil Meese will do abstract number 1454. It's 3-year safety and tolerability tolerability data on bimekizumab, and that's looking across phase 2b and phase 3 PsA studies and also AxSpA studies. And what has he found or is presenting on? Confirming sustained efficacy with consistent safety profile of bimekizumab. Uda Klitz, number 1462, will report 5-year results from the Serena study of secukinumab, and that describes the maintenance of MDA or minimal disease activity and great favorable outcomes across biologic naive up to and including biologic experienced patients. In another analysis that complements this one, Uda Klitz will do number 1464, evaluating cardiovascular safety over 5 years, and great that no increased incidence of major cardiovascular events or MACE events is found in the population of PsA on secukinumab. Additionally, Dr. Javier Godo, number 0559, will look at a systematic review looking at cardiovascular impact of secukinumab across PsA, AxSpA, and also Lee Etter will look at abstract number 2358, giving a pooled 1-year data of phase 3 studies with bimekizumab showing early and sustained efficacy regardless of baseline characteristics. So lots of efficacy, no new safety signals, lots of good data on IL-17s. Moving to the IL-23 inhibitors, as you all know, they're used quite heavily in psoriasis, as are the IL-17s that I just mentioned. So IL-23s, what are we going to hear about? So Alexis Oggi is going to have a presentation number 0563. She'll be reporting on both efficacy and safety of guselkumab as an IL-23 inhibitor and PsA, and those in this case have had an inadequate response to TNF inhibitors. Well, Alice Gottlieb, number 0564, will be highlighting PROs over 24 weeks in the same population. Dr. Daphne Gladman from Toronto will be looking at abstract 2354, looking at sex-specific post-hoc analysis from a phase 3 guselkumab study and linking early clinical response with reduced radiographic progression. Phil Meese will be on abstract 2368, giving the 24-week data from APEX trial, and that'll show structural inhibition of damage from guselkumab in the patients. There's real-world studies that have give added value in this context. So Phil Meese will do 2369, comparing a 24-month persistent for guselkumab versus IL-17 inhibitors. So lots of good data in the real world that will help us. Beyond guselkumab, Atul Deodhar will be doing number 0567, looking at phase 2 ARGO trial of sonelokimab, which is tested in this case in biologic experienced patients, and a design of a phase 3 trial of IZAR-2 trial, and that's risankizumab as a reference arm. So that's where we'll find that drug being highlighted. Phil Meese on abstract 1456 will give us long-term follow-up on phase 2b open label extension of tildrakizumab and demonstrating sustained efficacy and safety up to 208 weeks, so 4 years of data. Dr. Amaro Kaiserman, number 2362, will add value to this, giving 244-week data on Keepsake-1, again confirming risankizumab's sustained or durable efficacy, and CSIR DMARD experienced patients, so CS-DMARD IR patients. Phil Meese will also come in on abstract 2367, again looking at risankizumab effectiveness on axial symptoms in biologic naive PsA patients. If that's not enough on the drugs, we also have great data on the JAKs that will be presented. So updated long-term consolidated data on JAK inhibition. So Ian McGuinness will look at in abstract 1443, giving the 5-year outcomes of phase 3 select PsA 1 study and confirming that upadacitinib again has a durable or sustained response and sustained safety in PsA. Also, with these results in mind, Phil Meese will look at abstract 1453, giving real-world data on patients who have switched to UPA versus TNF or IL-17 inhibitors after first-line TNF experience, and giving insights on sequencing strategies in clinical practice, because these are all questions that we have to grapple with in our patients with PsA. What else is there in mind? There's real-world data and clinical management. So in this area, other real-world studies will be presented looking at persistence, cardiovascular safety, and treating to a target implementation in PsA. Phil Meese on abstract 0362 will be presenting persistence for IL-17A inhibitors from the Corvitas database, looking at PsA and SPA. Long-term retention across therapeutic classes will be highlighted. Dr. Jean Gilman Letoroli, and I'm sorry if I'm saying the name wrong, I probably am, but this is abstract 0572, is reporting on 48-week outcomes of the Monitor PsA cohort, demonstrating feasibility and effectiveness of real-world treat-to-target approach. And again, this is where this study is looking at different approaches in early PsA and then over time. April Armstrong will present number 2689, comparing PsA incidence among psoriasis patients treated with IL-17, IL-23, IL-12, 23, or TNF inhibitors. So this is something looking at, is there going to be a prevention paradigm here? So this is an exciting abstract and giving epidemiologic context for treatment choice. Well, Milad Hederi Kamjani, and abstract 2363 will look at the cardiovascular and thromboembolic safety of biologic therapies and PsA in routine practice. So there's a lot of very exciting abstracts. If we didn't choose your favorite one, don't worry, because these are pretty amazing, and there were other amazing ones that we just couldn't choose them all. Thank you. So Atul, I think you're going to move on to tell us about what the cool things are happening at ACR 25 in Chicago on AxSpA.
Thank you, Janet. And there is definitely a lot to look forward to in the psoriatic arthritis arena, as you showed. So finally, let's take a look at the abstracts that we have picked out for axial spondyloarthritis. And I want to start with the abstract, which probably is the most groundbreaking and amazing abstract that we have been working on for literally 10 years, at least 9 years, if not 10 years. And this is the classic study. This is going to be presented by Walter Maximovich. This is a plenary presentation, 0854, and Walter will be presenting the development and validation of the revised ASAS or ASAS Spartan classification criteria for axial spondyloarthritis. The old classification criteria, as you know, were from 2009. These are going to be the ASAS Spartan classification criteria, which have better sensitivity, better specificity, presented in the plenary session by Walter. Starting with some drugs, so IL-17 inhibitors, several sessions focus on the long-term outcomes in clinical trials and real-world use of IL-17 inhibition in axial SPA. And Fabian Proft is going to be presenting abstract number 2347. And that abstract reports the bimekizumab treatment maintained clinical response over 3 years in 2 phase 3 studies and their open label extension. And Philip Meese follows, and Janet has already mentioned this abstract 1454 that presents 3-year update on the long-term safety and tolerability of bimekizumab across phase 2B and phase 3 studies, both in axial SPA and psoriatic arthritis. In the complementary real-world study, Jessica Walsh, in her abstract 1445, describes patient characteristics and physician-reported treatment effectiveness and satisfaction with bimekizumab in clinical practice in the United States. So those were some abstracts that we picked from IL-17 inhibitors. Coming to JAK inhibitors, data on JAK inhibition provides insights into comparative outcomes in axial SPA. So Denis Podubny in abstract number 1435 examines the impact of upadacitinib on non-nociceptive pain. Non-nociceptive pain is another word of saying central sensitization or nociplastic pain, and residual symptoms in a multi-country observational study. Jeff Curtis, in his abstract number 1444, compares the real-world effectiveness of tofacitinib, TNF inhibitors, and IL-17 inhibitors among patients with axial spondyloarthritis, providing data on treatment sequencing and relative outcomes. Lastly, coming to the TNF inhibitors, treatment persistence remains a key focus, of course, in the management of axial spondyloarthritis. And Jose Miguel Senabre, in abstract number 1446, presents findings on second-line treatment persistence in anti-TNF experienced patient, comparing cycling within TNF class versus switching to a therapy with a different mechanism of action, a very important clinical question that we have. Lastly, the cardiovascular safety, there are safety outcomes are explored in a cross-disease context. Javier Godot, in abstract number 0559, reports a systematic review assessing the cardiovascular effects of secukinumab across psoriasis, psoriatic arthritis, and axial spondyloarthritis, summarizing evidence that informs broader safety profiles for IL-17 inhibitors. So again, a lot to look forward to also in the axial SPA arena.
We hope you've enjoyed this preview. The IMID Forum has plenty more ACR coverage planned as Congress gets underway. For a condensed overview of the most important abstracts and posters each day, be sure to look out for our daily highlight videos. After the meeting, we'll broadcast an EULAR Congress Review podcast where Janet and Atul will be joined by Sophia Ramiro. This will be a great opportunity to listen to our discussions around some chosen abstracts and focusing on the data presented. It's not to be missed. Don't forget to visit imidforum.com and download our ACR 2025 preview brochures, which include details of the faculty's top abstracts. And all that remains is for me to say, enjoy the Congress.